New Trump rules for the Affordable Care Act, which will impact covered California. Hello, I am Kevin Knaus, an independent health insurance agent in California, and also a certified covered California agent who enrolls individuals and families throughout the state. And the Trump administration's Center for Medicare and Medicaid Services has proposed new rules for the administration and eligibility of the Affordable Care Act, which is essentially covered California, because covered California is a marketplace exchange in the state. And these are proposed rules. Some of them may be tweaked a little bit. Some will be challenged in court, but some of them are significant enough that it's good to be aware of them, because some of them will come into effect if they are adopted in 2025, and then others will go into effect in 2026. One of the first ones is the payment of past due premiums rule. So if an individual's in the exchange and they then let their coverage lapse, let's say in November, for non-payment, they don't pay their premiums, and because maybe they've gone out of the country on an extended trip and just forgot about it, when they go to renew or enroll for the next year, before they can get their coverage effectuated for the next year in January, they need to pay the past due premiums. Now, this always seemed odd to me, because when you stop paying your health insurance premiums, the health plan terminates, and any healthcare services that you had under, in that time after it had lapsed are not going to be covered. So I'm not sure how they were past due if the health plan is terminated. However, that's going to be the rule, and they will allow insurers to collect those premiums for the enrollments where the enrollment was terminated for lack of payment. A shorter open enrollment period. Currently, the open enrollment period is November 1 through January 15th, January 31st in California. CMS is proposing that the open enrollment period be shortened from November 1 to December 15th. And this is going to be a challenge for some people. You know, we have the holidays, and people just aren't necessarily focused on health insurance, or they're enrolled and renewed, and in January they realize, oh, this is the plan I want, I need to do something else. But you won't have that option, because it will close on December 15th. I don't know how California is going to deal with that, covered California, if they have any latitude with that, but that is the proposal to shorten the open enrollment period. Deferred action for childhood arrival individuals will no longer be eligible for the premium tax credits through a marketplace exchange. It has to do with lawful presence, and CMS says that people with DACA status should not be able to participate, so they will be excluded. Failure to file a tax return. Currently, people who did not file a tax return because maybe they're still working on different stuff, you could attest that you will be filing, and that you had up to 2 years. But now they're going to shorten that to 1 year. But it's unclear whether that means you still have to have them filed before you enroll, if you had to reconcile past premium tax credits, but they're going to be tightening up on the federal tax return. So it essentially means you need to file your taxes, or you may not be eligible for any of the premium tax credits. There's a couple different changes regarding income verification. One of them is that they are going to require the exchanges to start verifying income more diligently. Those individuals where there is no IRS tax data or Social Security income data will have to provide hard evidence documents of their income. And before, you could just file an income attestation, I'm going to make $40,000. But if that is your estimate and you did not have that in the prior year on the tax return, it won't be accepted. And so they're tightening up on the income verification. So you want to get all your records in order so that you will be able to provide some sort of evidence for your estimated income in the next year. Active renewals or a $5 premium. So right now, people during the open enrollment period are passively renewed into their existing plan at the subsidy based on the current income. And a lot of people just rolls over, and many people are okay with that. CMS is proposing that people need to actively review and confirm their enrollment, the conditions, the income and all of that. If they do not actively confirm that they are eligible through their account, then they will be assessed a $5 monthly premium. And they must pay that $5 monthly premium even if their health plan is zero because the subsidy is greater or equal to the health plan premium. And so that's going to be kind of a wake-up call, because people will get this invoice for $5 and it's like, well, what's going on? And you have to pay that. Now they state that $5 for a number of months will be returned as a credit on the income tax return, but it's still going to be kind of a shock to some people because things just won't roll over. You will have to actively engage the account. Currently, with Covered California and some of the other exchanges, they have the ability to upgrade people from a bronze plan to a better coverage silver plan when there was really no premium change and it's with the same carrier. And that helped out some people because the bronze plans have large deductibles and everything, and the silver plans have better cost sharing. CMS proposes doing away with that. No more upgrade by the exchange, Covered California, from a bronze to a silver plan. They say that's consumer selection and no one should touch it. Special enrollment periods. There is going to be more review of the special enrollment period verification. So if you lose your job in the middle of the year, that is a qualifying life event, loss of coverage, to enroll in Covered California and receive the insurance subsidies. And for the most part, people just said, we just go through and loss of coverage and everything goes through. Now, Covered California states that they kind of randomly check people to make sure that they really do have that qualifying life event. But now they're going to have to check, I guess from what I read, 75% of those. So, but just assume that if you're coming in to Covered California under a qualifying life event of loss of coverage or moving to the state, you're going to have to provide proof that you do have that qualifying life event. So that's maybe difficult for some people, but it's going to be out there. Prohibition of sex trait modification services. And that really just goes to people getting healthcare services if they're transitioning from male to female, female to male, transgender. Now, this will definitely be challenged in court, and even CMS notes that states have latitude regarding what a coverage benefit is for their health plans in that state. But for those exchanges that CMS or HHS, Health and Human Services Department, manages, they're not going to allow any transgender healthcare services. For example, hormone therapy. That will not be a covered service. You would have to pay for that out of your pocket, or if your child needed hormone therapy for help in the transition, you have to pay for that out of pocket. But we'll have to see how that all plays out in the courts. These rules favor the insurance companies, as far as I can tell, and everything I've gone through. And there's a couple other technical rules that I didn't get into, but they're all slanted towards the insurance companies. And CMS, peppers their information with adverse selection and fraud and preventing those and stabilizing the insurance marketplace and whatnot. But last time I checked, none of the health insurance companies have cancer. They have not been diagnosed with a chronic illness. They don't have, clinical depression. They don't need healthcare services. They seem to be healthy. It's Americans that seem to get sick, not the health insurance companies. So I'm not quite sure why all of these rules are trying to be put in place to help the insurance companies when the Affordable Care Act is to help the consumers. And CMS talks a lot about, fraud and adverse selection, where you just jump into a plan, get your health care covered, and then you drop the plan because you don't want to pay the premiums, and other fraud. But they didn't really, show any definitive proof that is happening on a wide scale. Maybe it is, but I don't see it. But these are some of the proposed rules, so be on the lookout. Things will be changing at Covered California in 2025 and definitely for 2026. If you have any questions or comments, you may leave those down below. I will post the CMS press release on these changes and their Federal Register submittal so that you can read through them for more accuracy and details. Otherwise, have a nice day. I am Kevin Canals with InsureMeKevin.com.